I am Dr. Ramasubramanian, consultant in infectious diseases at the Capstone Clinic. We are coming across a lot of cases of flu these days. What is flu? This is a respiratory virus infection which typically causes fever, headache, body pain, sore throat, maybe a runny nose and cough. A lot of these symptoms occur with cold also, but flu is different because usually there is a high fever associated with flu and the person feels very unwell. So much so that you have to take off from work. Usually the symptoms last 3 to 4 days and then the person slowly gets better but may have a persistent cough and severe tiredness. Now this flu virus has been around with us for a number of years. It has caused outbreaks which sometimes have involved epidemics or even pandemics. And every year the flu virus which circulates is slightly different. These are called the strains of the flu virus, and the strains keep changing every year. That is why we need to look for what kind of virus is circulating every year to decide on the type of vaccine we need to prepare. Now this virus, as I said, can be mild with infection settling in 4 to 5 days in most people, but in certain age groups, for example, children under the age of 5 years, elderly people over the age of 65 years, or people with underlying comorbidities, diabetes, high blood pressure, heart disease, kidney disease, the flu can lead to a lot of complications and even to death. Before COVID came in, flu virus was responsible for a significant number of deaths every year, and it continues to be so. So what should you do when you get a flu, or what should you do to avoid getting a flu? If you have symptoms of fever, cough, cold and body pain, please stay away from work. If you are employed, stay at home. If your child has fever or body pain or cold, keep him away from school. Do not send him to school. The illness is infectious through the droplets which are produced by coughing and sneezing. So whenever you cough or sneeze, cover your mouth, or with a kerchief or a tissue, cover your mouth so that you don't splatter droplets which may spread the flu virus. Take rest, paracetamol and plenty of fluids. There is a medicine called oseltamivir, which is an antiviral which has been tried for flu, but studies have shown that it probably reduces the duration of symptoms and does not do any major help in preventing complications in most situations. So the most important intervention to prevent flu is to use vaccines. Vaccines are available every year in the northern hemisphere. The new vaccine comes in September. As soon as the vaccine is available, take the vaccine every year to prevent complications and severity of flu. Sometimes the flu in tropical countries can happen all through the year. In Western country it is typically a winter infection, but in countries like India, since it occurs all through the year, take the flu dose before the vaccine. Whichever flu vaccine is available, take it at that time. So please ask for the flu vaccine, take your flu shot, stay healthy and prevent complications. Thank you.